The question is, what disease kills 50% of people and starts in childhood? So what disease is this, and how do we prevent it? That's what we're going to cover. The answer is atherosclerosis, which essentially is plaque formation in the arteries. So what diseases cause this? Well, stroke, heart attack, kill more than 50% of people that end up with disease, typically over 65 years old. What's interesting about this is data shows it starts in childhood. Yeah, that's right, childhood. So how do we know this? We know this because of chemotherapy in kids with cancer have higher rates of vessel disease, including heart attacks. Autoimmune diseases of childhood can increase the risk of heart attack in kids. And autopsies have shown that there is plaque formation during childhood. So this is something that actually starts pretty early in life, and that makes it even more important to take care of your kids properly, good diet, exercise, etc. So atherosclerosis, essentially plaque formation in the arteries, causes heart attack, stroke, can cause kidney disease because it blocks the arteries, peripheral arterial disease, which usually presents in the legs, causing leg pain and things like that, and diabetics especially. What is it? It's a chronic inflammation. Notice inflammation disease of the arteries. So what happens here is HDL or LDLs, low density lipoproteins, accumulate along the vessel wall because of inflammation. So too much cholesterol, high blood pressure will damage the arteries, cause inflammation. Diabetes, uncontrolled blood glucose causes inflammation. Cigarette smoking, too much alcohol causes inflammation. Obesity releases inflammatory signals causing inflammation. And the bad thing about this disease that kills 50% of people is there's no symptoms until it happens. So quickly, we'll look at this actually cutaway of an artery. Oh, sorry about that. Here we go. This is the muscle layer of the artery. This is also the muscle layer of the artery that is formed, and under it here is fat plaque. So we've basically narrowed this artery. Now, this won't kill you. What will kill you is when this fat ruptures and goes into the artery and gets stuck in this picture over here on the right, killing you essentially because you're having a heart attack or stroke or some other issue. So is this just a plumbing issue? No, all the data is saying that heart attacks, 75% of heart attacks occur from that rupture of that plaque, that atherosclerosis. So here's a little image from Cleveland Heart Clinic. What we have is a nice, healthy cutaway of an artery. Worst case is this plaque formation causes a clot to form because it ruptures that lipid layer that the body's trying to take care of, keep it controlled. And when that ruptures downstream, it causes platelets to adhere and causes clotting. And that's when we have a full-blown heart attack. And that's the real issue, heart attack, stroke, whatever it is. So I just wanted to talk a little bit about the inflammatory pathway. We know this is caused from inflammation of something in the arteries. It starts in childhood. The inflammatory marker that people much smarter than me have figured out is NF-κB. And once that starts in the artery, what happens is it attracts cholesterol. And it actually, if you look at the little arrow, that cholesterol gets trapped in the muscle layer of the artery. Yes, muscle is artery. And when that happens, the inflammation of that cholesterol oxidizes it. And when that happens, it reduces nitric oxide, which causes the vessels to contract. So not only do we have inflammation in this thickening plaque, we also are contracting the arteries to even slow blood flow because of the molecular issues that's happening. Now, at this point, immune system gets involved, and it gets in there, monocytes and lymphocytes initially. Monocytes turn into macrophages and tries to stabilize this clot. It's an inflammatory process, so the immune system's involved, and that's what this is kind of showing with these little green dots, all the inflammatory molecules coming from the immune system. Now the body tries to wall this off. It creates a scar almost, which we know as a fibrous plaque. So if we can wall this off, we're safe. We're gonna be safe over time, hopefully. But the problem is if you notice how thick the muscle layer is here, as we're forming this plaque, notice how thin it is. And that is at risk for rupturing this hot plaque that gets downstream, gets stuck, attracts platelets, and we get a clot. Now, at this point, we have atherosclerosis at this point. This is the rupture. So as the artery narrows from plaque building up and narrowing this artery as shown here, we get a slowdown in arterial flow to the cells that need that blood flow. And what the body will try to do is create extra vessels around that we know as collateral circulation. That's why exercise is important. If we do have some narrowing, exercise will stimulate the body to create collateral arteries to bypass some of this. Now, we can't bypass a hot plaque, but the body can learn to bypass some narrowing from this, okay? So there's an article here I pulled from Up to Date, which is a clinician resource for journals. And this group of teams who are pathologists, people that take cells and study them, in March 2013, did a review of 22 autopsy studies. Now, these are large studies, collected 22 of them, and they examined 847 heart arteries. What they found is 79% of people that died of heart attack, it occurred from that plaque rupturing. Now, so it's not just narrowing is the problem, it's that rupture of that fat. So once again, this picture, here's that fat, the body is walling it off with muscle essentially, but as that fat grows, it narrows that muscle layer, which can cause a hot rupture, and then the platelets and all that is attracted to that area, causing the clot and a complete narrowing. Now, the other 21% is related to narrowing, like the arrow showing here. A stenosis is what the medical name is. So technically, we can have the narrowing. Here's the cholesterol and the immune systems and so forth, and calcium gets involved. We can have a narrowing, and this is still fairly relatively safe. Exercise will help create some bypass here. But if our lesion is unhealthy and narrows to an extreme degree, we're going to have a real issue if some plaque upstream here ruptures. It doesn't take much to cut this off, where this may allow flow downstream a little bit. So what do we do to prevent all this? Reducing inflammation. Just reduce your inflammation. Well, that sounds easy, but there's a lot of things going on here. So there is 2 blood tests that you can get done at a doctor's that check for inflammation specific to the artery. That is the high sensitivity CRP, hsCRP, and the lipoprotein PLA2. So both of these markers can tell you how much inflammation is in your artery from plaque formation. Okay, so what can we do about this? Lose the weight. Obesity is related to inflammation. It releases inflammatory markers in the body and chemicals, worsening the arterial walls, attracting LDL cholesterol to the walls and starting the formation of atherosclerosis. We need to stop smoking, reduce our alcohol intake. That's all healthier for the arteries. We need to exercise almost daily if possible. It doesn't have to be crazy intense, but some moderate exercise to help with collateral circulation if we have the stenosis like this lesion is showing. The other thing I recommend for diet, I actually prefer the paleo diet. It's essentially lean cuts of meat, fruits, and vegetables. By doing this, you're going to eliminate most sugar, most carbohydrates that have tons of sugar put into them, which will help reduce inflammation. We know vegetables and fruit reduce arterial inflammation. We need to get LDL cholesterol under control. It's caught at the scene of the crime. It's a contributing factor to it, but not the cause. The cause is inflammation that attracts the cholesterol. But we still need to get our cholesterol under control to reduce some of that from happening. We need to get our blood sugar under control. Elevated blood sugar going above that 5.7% that's normal in our arteries causes inflammation. We release chemicals that cause inflammation. That includes prediabetes. It includes diabetes for sure. It's like diabetes with all that blood sugar running around is essentially you pouring gasoline in your arteries. We need to get our blood pressure under control because high blood pressure slams the arteries, especially where they split, causing inflammation, attracting the LDLs and the immune system in there, forming atherosclerosis. The other thing that isn't talked about a lot, but is super important, is reducing stress. Stress causes inflammation. It causes a chronic cortisol release. It increases adrenaline release, which increases blood pressure, which increases pressure on the arteries, causing the inflammation cascade. Thank you very much. If you have any questions, let me know.